It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
Our next guest, Dr. David Escobar, where the topic is men's health. He is a family medicine physician from Skagit Regional Health in Stanwood. And, of course, more and more men's health issues. There's even a magazine called Men's Health. That's how much there is.
You're sophisticated, aren't you? Yeah, Men's Health. We wanted to have a physician, Dr. Escobar, come on and talk about men's health because men tend to ignore their health.
That's the reality. All right, here's Dr. Escobar and Shannon O'Kelly.
Dr. Escobar, welcome to Health Talk. I hope you're having a great day. You look like you are. How are you doing?
I'm doing great, thanks. It's always great to be back up in Seattle.
Absolutely. Good to have you. Tell us about your practice and where you work, your clinic, and kind of your training. I like to call it the day in the life of Dr. Escobar.
Day in the life for me is pretty unpredictable. I'm a family physician, so we never know what walks in the door, essentially. And so I work for Skagit Regional Health, primarily in our Stanwood, Washington clinic, very top northwest corner of Snohomish County, and take care of just about everything. Being a relatively small town or small city family physician, we handle about 80% of folks' healthcare when they come into the office.
Tell us about your training, because you're local. You grew up in the Puget Sound. You were educated out in the Yakima area. We just had those folks from your medical school on the radio talking about that hidden gem out there in the middle of the state of Washington.
Yeah. I'm a Washingtonian, native Pierce County kid, and went to Wazoo for undergrad, and then ended up going to medical school at Pacific Northwest University, which is an osteopathic medical school in Yakima, Washington. I think jewel is quite the right word for it. It was a great experience, med school, which not many people can say. Med school is usually fairly grueling, and most people don't look back on that with a great deal of smiling and cheerful thoughts, but I had a great time during those 4 years.
And it's kind of neat to see the philosophical interest of your school out there is to train local physicians to stay local, to provide local care, and it kind of worked for you.
It did. So it's focused on recruiting folks from communities in Washington State and Pacific Northwest at large, and then sending them back to those communities to practice once training is all said and done, which on minimum takes about 7 years. So it's quite the commitment, and it's quite the feather in the nest, so to speak, that the school can actually point to high percentages of graduates, alumni, coming back to practice in their communities in Washington State.
Congratulations, on your practice and what you're doing. Let's talk about what you're doing. You're a family physician, but we want to talk about men's health. And what you and I probably know is men are reluctant sometimes to seek medical care or go to the doctor. Usually it's the women in our life that are kind of directing us to go get our annual physicals, et cetera, et cetera. We're going to talk men's health. How about that?
I'm glad we're doing that. In medicine, whenever a patient comes to us with an issue or problem, we always call it the chief complaint. And when most of my men come to me with a chief complaint, it's my wife made me come in. So I'm glad we're going to talk about this today.
Yeah, I had to come in, my wife, which is good. And there are things that we should watch as men. We talk about women's health. And at IRG, we have therapists that specialize in women's health, but we don't talk a lot about men's health. So that's what we want to do. So this is a variety hour of men's health. Okay, let's talk about weight gain, stress, and lack of sleep. Let's do that area.
Absolutely. We could probably start with lack of sleep because that is sort of the umbrella that impacts pretty much every aspect of health, whether it's physical, mental, social, emotional. Lack of sleep or sleep deficiency will certainly negatively impact health overall. And it's a difficult problem to tackle because, of course, with most things in medicine, there's so many variables that play into a problem. Folks have a hard time sleeping because of maybe they don't have good, what we call sleep hygiene, which is appropriate sleeping environment, that's dark enough, it's cool enough, it's comfortable enough. And then I think the overriding problem that we have so often in our society at large is that most of us are so driven to work extra hard. And folks are usually lacking in sleep because there just aren't enough hours in a 24-hour day for most people. Yeah. And so sleep kind of gets shunted to the side a little bit in terms of priority.
And go back to when you were 16, 17. I remember, it's a long time ago, but I remember I could sleep until noon. You'd wake up, half the day would be gone, your family would be already done a lot of stuff, but we can't really sleep like that anymore. We just automatically wake up after 6 hours. I like to say I can get 8 hours of sleep.
Yeah, absolutely. And also, folks initiating into bedtime, what time they go to bed, keeps prolonging.
More with Dr. David Escobar and Shannon O'Kelly next, right here on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
We continue our conversation on men's health with Dr. David Escobar, family medicine physician from Skagit Regional Health in Stanwood.
Dr. Escobar, again, thank you for your time. Thanks for joining us on Health Talk. You're a family doctor up in Stanwood with Skagit Regional Health System or Centers. Is that fair to say?
It's fair to say, yeah, it's a regional health system, yes.
Right. And we're talking sleep, which, sleep can be the root of all problems. We talked about the sleep needs. We talked about, we all need about 8 hours of sleep. We talked about sleep hygiene. But, how do you fix it? Or how do you help fix it? We talked about maybe your sleep environment, but what else can you do?
The best thing, I think, is to help folks reprioritize sleep. Like I had said earlier, it tends to get shunted down to a lower priority. I'll get to sleep when I can get to it. And then when folks have trouble falling asleep, staying asleep, not feeling like sleep is rejuvenating, then sleep becomes the enemy. And it's like, I have to get up in X amount of hours. I think you keep looking at the clock, and then it becomes a battle. So the best thing is to reprioritize sleep. And as there's a faculty member I've worked with a little bit down at the University of Arizona, Dr. Ruben Nyman. He's a psychologist that specializes in sleep, essentially. And he has espoused this beautiful concept of we need to fall back in love with sleep.
One thing that we should say is that, you should, if you're having problems sleeping, from a medical standpoint, there could be other things going on. You may have sleep apnea.
Yeah.
There's a lot of different things that you need to have checked out.
Absolutely. And there's a bit of a danger zone as well, because a lot of the sleep aids that exist can actually be detrimental. A lot of them can actually suppress the dream cycle, the REM sleep cycle, which is when our brains are getting the most rejuvenation and rest, and memories are forming, etc. So it becomes incumbent to start exploring, A, if there's a medical condition underlying that sleep problem, but B, if there's just something we just need to help someone ease into sleep or stay asleep more gently, there's different ways to go about doing that.
Let's talk about another men's health topic, and that's testosterone replacement. Seems like, if you listen to these commercials, everybody has low testosterone.
Yes.
You got to go out and get it tested, but that's not necessarily the case for the most part.
It's true. It's one of these misconceptions we battle in medicine and in healthcare, because it's a heavily marketed concept that low T is bad. There are two camps. One camp says that we do know scientifically testosterone decreases as men get older. That's
we do, yeah.
Expected physiologic change. And then the folks in some camps will say, well, that's just a normal physiologic change. We shouldn't be doing anything about that. We shouldn't be intervening upon that. And then another camp, another school of thought, which is fair, also will stipulate that, people are living a lot longer, men and women, a lot longer these days. So should we not maybe start to engage in some hormone replacement therapy if levels are low enough, if it's safe enough, in order to improve quality of life? We do know that low testosterone does lead to decreased muscle mass, decreased bone density, and that will negatively impact men's health as they get older.
When should the intervention be handled? When is it necessary?
That's a great question. And really, we focus on clinical symptoms. So when men are showing increased signs of fatigue, decreased stamina, decreased virility, maybe even decreased sexual endurance or libido, then we start to discuss, could this be part of the problem?
Well, Dr. Escobar, thank you again for your time. Unfortunately, we're out of it right now, but we just kind of touched the tip of the iceberg of men's health. I'd like to have you back in the future. We can continue to have conversations because we haven't touched other areas, but most importantly, men out there, get your annual physical. Don't be afraid to go to the doctor.
Talk to your doctor.
It's okay.
Talk to your doctor. Yes.
Thank you.
Men's health, it's a broad topic, Shannon. As you mentioned, we don't ask for directions, and we don't go to the doctor as often as we should.
And we should. We should, 1, ask for directions. 2, go to the doctor.
We thank Dr. David Escobar once again. You can get more information on him by going to SkagitRegionalHealth.org. We're back with our final segment right after this timeout on Como.